News Channel 7. This is Viewpoint.
Welcome to Viewpoint. I'm Doug Petcash. So now we move into year 2 of the fight against COVID-19 in Idaho. We've gone through a lot since the first case was reported in the Gem State back on March 13th of 2020. Over the course of the year, many people have gotten sick, lost loved ones, or lost income. But we've also come a long way in the battle against the virus. Now we have more weapons to fight it, specifically 3 vaccines, and Idahoans are getting shots. Here are the COVID vaccination numbers for the state as of Thursday morning. According to the State Department of Health and Welfare, nearly 550,000 total doses have been administered. Nearly 340,000 Idahoans have received vaccine. 127,000 have received 1 dose of a 2-dose series, and more than 211,000 are fully vaccinated, depending on the brand. It's stated that way because the Pfizer and Moderna vaccines require 2 doses, while the Johnson & Johnson or Janssen vaccine requires only 1. Since last March, the state has reported more than 176,000 confirmed and probable cases of COVID-19. More than 1,900 Idahoans have died of COVID-related illness. The percentage of positive tests has dropped to 4.6% as of Thursday morning. That is down from a high of 19.1% back in late November. But over the last 2 weeks, case numbers and hospitalizations have been climbing again. Coming up in about 15 minutes, I'll break down the groups that will become eligible to get a vaccination in the coming days and weeks. My first guest is infectious disease specialist, state epidemiologist, Dr. Christine Hahn. Dr. Hahn, good morning and thanks again for your time.
Thank you.
All right, so Dr. Hahn, was it a situation like this pandemic that got you interested in being an epidemiologist in the first place?
Yes, when I was in medical school, I always thought infectious diseases were fascinating, not just clinically interesting, but really how they've changed history. My father was a history professor, and I think I inherited a little bit of that interest in how over time, what really changes the course of the world and how pandemics and diseases are so influential and important. I think that's what kind of caught my interest.
Well, how would you describe the last year for you? And, short year, did it go really fast, really slow, just so busy?
Yeah, a little bit of both. I've been in public health since 1995, a long time. And, we've been through a lot. I felt like I had a really busy life. I did a lot of work. I think of everything from the anthrax attacks, certainly E. coli outbreaks, salmonella outbreaks, the West Nile coming into our state for the first time in 2006 was when we had our real bad year with West Nile. And then more recently, I've been working on the opioid epidemic, which is, of course, a real important public health problem in Idaho, and working with others in our department on that issue. But this past year has been like nothing else. It was so difficult. We always knew a pandemic of any type. We thought it would be influenza, not coronavirus. That's what we had mostly planned on and talked about was pandemic flu. And it is far worse, I think, as far as a burden on the people, burden on the state, the economy, and incredibly hard work for our entire public health team. It felt like a really long and difficult year, but it's also amazing and that it's flown past, that it's been a year. It's just hard to even comprehend that it's been that long.
Well, right now, currently, as we see a slight uptick over the recent couple weeks, how do you feel about the situation as it stands in terms of the case numbers, hospitalizations, and positivity rate?
Yeah, so we've been so pleased in the last several weeks, really to see the case numbers continuing to drop and the hospitalizations especially dropping, the deaths, the decreased number of outbreaks in our long-term care facilities. We've been so relieved and pleased. We believe there are several reasons for that decrease, which is partly that this is probably acting like a seasonal virus. Spring is coming and maybe the virus on its own was starting to drop off. We are hoping that Idahoans' continued behavior with masks and separation was helping. And of course, the vaccine was starting to be administered around the state. However, as you mentioned, we've seen that bottom out, it appears, and now we're starting to see a little bump, especially in some parts of the state. in our eastern part of the state. And in particular, we're very concerned about it. We're worried that the influence of variants coming into the state, new different types of strains of that virus, might be causing part of this. People might be letting down their guard and getting back together and without masks. So we are concerned that we are going to see another rise in cases. We are doing everything we can. I know Sarah from our immunization program will be on the program and talking about our immunization efforts, but we know that healthcare providers around the state are working really every day of the week to try to get vaccines out to people who want them. And we really hope that will help protect especially the most vulnerable among us as we see cases maybe start to rise again.
So, Dr. Hahn, what's it going to take to reach herd immunity?
Yeah, so herd immunity is really that point where the virus starts to die out as far as it can't spread anymore because there are so many of us that are immune. So if I have COVID, instead of spreading it to my two family members, say, or a coworker and a family member, now I am less likely to spread because they both have had the vaccine or they've both had COVID, they're immune, they're protected, and I don't necessarily spread to those folks anymore. We don't know because it's a new virus. We don't know for sure what percent of the population needs to be immune for that to happen, that phenomenon to start happening. Right now, the estimates that we're seeing, especially taking into account the new variants, are as high as 80% of the population needing to be immune before we really could start to see this start to get completely suppressed. We don't think we're there yet. The best data that I have right now to look at is data from blood donors that come in and donate blood through the Red Cross, whatever weekly. The Red Cross tests all donors now for antibodies to COVID, and we're sitting at about 25% of Idahoans right now having some type of immunity, whether it's through vaccination or natural infection. So we have a long ways to go.
And with the percentage rate of vaccinations that you're seeing by eligible groups, do you believe that herd immunity will be possible in Idaho, perhaps this year, or is it just too early to tell?
Yeah, I'd say it's too early to tell. One of the big open areas, of course, is that for right now, there are no vaccines that are authorized for children under 16. 16 and 17-year-olds, there is the Pfizer vaccine available for them, although they're not yet eligible for vaccine. We're not even there yet. So it's going to be very highly dependent on whether any vaccines are authorized for children in the coming months. Studies are ongoing. We all just heard news earlier this week about some studies starting for younger children, but we don't know how quickly those will be finished, and we'll have data and what the data is going to show.
Let's talk about the vaccines themselves for adults. One question we hear a lot is, does the vaccine give a person immunity or just protect them from serious illness?
Yeah, that's a great question. We believe that in most cases, it does both. I think most of us, if we had to take one or the two, would say, hey, what I really want is I don't want to worry about ending up in the hospital or, heaven forbid, dying from this disease. And we know that all three of the vaccines that have been authorized do a great job at preventing severe illness, at keeping people out of the hospital, at keeping them alive. So that is one reason these three vaccines have all been authorized by the FDA. However, there may be differences, and we just need to keep studying and watching and collecting information on this over time. But there may be differences in whether it prevents you from getting sick at all, or even asymptomatically picking up the virus and maybe carrying it in your throat and passing it along to other people. What we'd love is vaccines that prevent all of that prevent you from even acquiring that virus and maybe passing it on. And that data is starting to come out. There's some evidence now that the vaccines are pretty good at also preventing you from even asymptomatically picking it up. But we don't have enough data to make that statement yet firmly. That's why even those of us that are vaccinated are still wearing our masks when we go out in public and that kind of thing, because we don't want to, heaven forbid, pick up the virus and pass it on to somebody else without realizing it.
Another question I hear quite often is, will people need to receive a COVID shot every year like they do a flu shot?
That's another great question. I wish, I always hate saying we don't know, but to be honest, there's a lot we still aren't sure about. One of them are these vaccines, which are new, are they going to protect us for ever? Are they going to protect us for just a few months? Are they going to protect people who've been vaccinated for about a year? Kind of like the flu shot that we know we have to keep getting vaccinated against the flu because the vaccines don't give us that long-lasting protection that we need against flu. So that is being very carefully watched as well. Those patients that volunteered for the clinical trials way back when, they're being still followed to see if how long that protection lasts. How long do those antibodies last? How long are they clinically protected and not getting COVID? So we'll know more and more. Every month we accumulate another month's worth of data.
Okay, give me a call when you have that nailed down. I'd appreciate
That's
it.
right.
Yeah, okay.
That's a key. That's a really important question. So we are very, very interested in that. We, the public health community, the medical community.
Well, finally, some people, of course, choose not to get vaccinated. Others are on the fence. What do you say to those on the fence about receiving a vaccine?
Yeah, so for folks that are on the fence, I totally understand. First of all, it is a new vaccine. It was developed, meaning all three of them are new vaccines. They were developed much more rapidly than most vaccines, although it's important to note that the science that those were based on has been studied for decades. The mRNA technology, the interest in adenovirus vaccines, which have been already used for other vaccines. So there's a lot of work has been done really since SARS back. You might remember SARS-1 back in 2003. After that, there was a lot of interest in developing vaccines against coronaviruses. So there has been a lot of background work going on. But I understand people saying, this is new and I'm just not ready to get vaccinated yet. I want more safety data. I want to see what happens to the folks that have been vaccinated. Totally understand. What I ask of you is please stay engaged. Please keep up, watch, read the literature, read the news you're hearing. And remember, the vaccine will continue to be available. So even if you don't get vaccinated today, please keep an open mind and consider it down the road, because we really would like as many folks as possibly protected in the state to really protect our elderly and our folks most vulnerable. Such
a good point right there. Dr. Christine Hahn, state epidemiologist for Idaho. Appreciate your time. I know how busy you are. Have a great day.
Thank you.
Well, still ahead, have you gotten vaccinated? Are you planning to? Have you been trying to? Up next, we'll look at how the vaccine rollout is going in Idaho.
This is Ford Truck Month. Get the best offers of the year on America's best-selling trucks, like the all-new 2021 Ford F-150 with a tailgate that doubles as a work surface. And count on the legendary performer, Ford Super Duty, our most capable heavy-duty pickup. This is Ford Truck Month. Don't miss it. During Ford Truck Month, get $4,250 total cash back on a 2021 F-150 only at your local Ford stores.
So if we're going to spend a third of our lives sleeping, shouldn't we try to get the best sleep possible? That's why Denver Mattress is all about that sleep life. And during the Super 7-Day Sell-Off, save big on the Doctor's Choice Firm, now just $569.99. Check out the budget-friendly Summit Firm for only $237.49. Or save $300 on Tempur-Breeze and Lux Adapt mattresses and get a $300 gift, plus 5 years no interest and free shipping. Denver Mattress, the easiest way to get the right mattress.
Love lower than low prices? Then get more ways to save at Fred Meyer, where you can find personalized coupons, weekly deals, and rewards like fuel points. All for prices that are lower than low. On food that's fresher than fresh. Fred Meyer, fresh for everyone.
Imagine yourself in a new Toyota.
Yeah.
Oh, yeah. Sweet.
With great deals, get ready to turn your dreams into reality.
Right now, you could get $1,250 customer cash on a new 2021 RAV4. Or you can lease a new 2021 RAV4 or RAV4 Hybrid for $239 a month.
Ready, set, go get your Toyota today.
Toyota, let's go places.
And welcome back to Viewpoint. We now turn our attention to how the vaccine rollout in Idaho is going. As I mentioned earlier, more than 500,000 total doses have been administered to more than 300,000 Idahoans so far. And more groups will become eligible to get vaccinated in the coming days and weeks. The state says vaccinations will be open to all Idaho adults by the end of April. Here's the timeline. On March 22nd, Idahoans between 55 and 64 become eligible. On March 29th, those between the ages of 45 and 54 with at least one medical condition can get vaccinated. Then on April 5th, vaccinations open up for all people in that age range. If you're between 16 and 44 and you have at least one medical condition, you become eligible for a vaccination on April 12th. And finally, on April 26th, vaccines open up to the general population in that age range, meaning all adults will be eligible for a vaccination in Idaho. So here to discuss the vaccine rollout in Idaho is Idaho Immunization Program Manager Sarah Leeds. Sarah, good morning and thank you for your time.
Good morning, and thank you.
So, Sarah, do you think there will be enough vaccine to immunize the general population by late April?
I do. The immunization program is in weekly communication with our federal partners, and which is where we get the vaccine. And we are told that in the first few weeks of April, we should expect a doubling of the amount of vaccine coming into the state for our vaccination efforts. And we are working daily with our partners, internal and in the Department of Health and Welfare and the local public health, as well as all the 450 enrolled providers and pharmacies in the state to ensure that we are ready to receive that much vaccine. And I believe that we are ready. And, nothing about this process has been smooth, super smooth and perfect, I guess, but we are ready, and we are ready for any potential bumps in the road.
So how many doses is the state receiving each week now?
Right now, we are receiving just under, the Idaho Immunization Program is distributing and allocating just under 75,000. And then there's the Retail Pharmacy Partnership Program, our federal, the large chain pharmacies in Idaho, which are Albertsons, Walgreens, Walmart, and then pharmacies under the Cardinal chain corporation are receiving an additional about anywhere from 12 to 14,000 doses.
Wow, so we're looking at like 85,000 doses a week right now?
Just about.
Okay, well, will the state start receiving shipments of the Johnson & Johnson vaccine again this coming week, or has that already restarted?
We are receiving a small amount of vaccine of Johnson & Johnson, and we are told that in the coming weeks, 1 to 2 weeks, that will ramp back up, but we don't have specific numbers right now. But our first allocation was 13,300, and then I think 2 weeks later we got another 1,900, and then we were allocated another 1,900 for distribution.
So right now, is there
small numbers, but they all add up.
That's right. Well, right now, is there still a supply and demand issue?
That's a great question, and it's kind of it's a push-pull kind of thing. Like, we are in this phase of the priority groups where we're starting to see what we think is a little bit of hesitation among some of the groups, because there are so many folks who are eligible now, but then there are still some folks who are not technically eligible. And we're hearing that some appointments are going unfilled. And so we're trying to work with our health districts and our providers to say, to the extent you absolutely can, stay in those priority groups, but also, do your best in terms of use your best judgment to not waste vaccines.
I was just going to ask about that, because I've heard of people, a lot more people now taking advantage of those no waste waiting lists. Is that paying off?
Well, I think so. We certainly don't want providers to waste vaccine. And that becomes particularly challenging at the end of the day, because, there's 10 doses in a vial of Moderna, 10 doses in a vial of the Johnson & Johnson vaccine, and 6 doses in a Pfizer vaccine, in the vial of Pfizer. And so if you open up a vial, very close to the end of your day, you don't want to waste 3 or 6 any doses. And so it becomes a challenge for providers to, walk that line of staying in the priority group, but also not wasting doses. And so we want to give them the grace to not waste the doses, but we also really want to stay true to the governor and our coronavirus vaccine advisory group prioritization.
So the rollout nationwide and here, got off to a slow start. How are you feeling about how it's going now?
I feel like it's going really well. One thing I heard we were on a call with CDC yesterday, and as you probably know, the normal work that the immunization programs across the country did before COVID was really heavily focused on routine pediatric vaccines and the federal Vaccine for Children program. And on a call yesterday with CDC, we are 14 or 15 weeks into this vaccination effort now, and there's been over 155 million doses across the country ordered. That's the equivalent of 2 years of vaccine ordering for the Vaccine for Children's program. So when you think about that scale of what we've done in 14 to 15 weeks, I think it's gone incredibly well. Of course, we've had some bumps, but we've never done this kind of scale of work before with vaccination in this short of a time period. So the bumps we have experienced are not unusual, but I think it's gone incredibly well. And our providers and our local public health districts, all our partners have done a fantastic job kind of rolling with all of those changes.
The state recently launched its online tool, the vaccination pre-registration system, to help people find appointment slots. Do you have any indication yet of how well that's working?
Yeah, it is working. It's working pretty well. We rolled that out really, really quickly in response to the challenges we saw with a lot of people having trouble getting on a wait list. And so, but we have 80,000 people on that list, and we are watching that. Providers are pulling down patients and contacting them, and we're moving through that list. Providers are moving through that list. So I think it's been a great thing. It's been a great tool that has helped Idahoans, have that peace of mind to know I want my vaccine, and I know that I have to wait, but I know now I'm in line for it. And I think that's been a great tool for us and for Idahoans.
And so what do you recommend for people, to do to be able to find a convenient appointment location at a convenient time for them?
Yeah, I think signing up for that tool is a great, one thing you can do, and it's sort of the casting the wide net in your area, and then any provider could contact you to get vaccinated. But then if you are really, really kind of chomping at the bit to get a vaccine, you can contact individual providers. Here in the Treasure Valley, there are major hospitals, St. Luke's and St. Al's. There's Primary Health, and they have, and all our local public health districts too have ways to sign up, and folks could be a little more targeted. I know, personally, I have family members who have signed up with various pharmacies and gotten an appointment that way.
So there are a lot of options out there for people to look. It might just take a little bit of legwork.
Yeah. I think it depends on the time you have. If you're very limited in time, that statewide registration tool is the easiest thing. And then you sign up, and then you just have to keep checking your email. And if you get a phone call from a provider, just make sure you're answering your phone and checking your email to see when you're notified. But if you've got the time, you can really search through different pharmacies, different providers to try to get an appointment.
Sarah Leeds, the Idaho Immunization Program Manager, thank you so much for your time. I know how busy you all are battling this pandemic, so take care and thank you.
Thank you. We really appreciate the opportunity to talk.
It's a lot of good information. We appreciate you. Well, I'll be back to tell you where you can find information on the latest trends and numbers surrounding the coronavirus pandemic at the touch of your fingertips.
I think every other burger should have a disclaimer. I'm not made with butter. That's what they should say right on the top of it. I'm not made with butter.
They should. They need to warn people.
Sonic Mesquite Butter Bacon Cheeseburger.
You gotta have butter.
We have it. They don't. Nelson's RVs has over 80,000 factory fresh RVs to choose from. That's more RVs for sale than anyone else on the planet. RVs for as low as $139 a month. Don't overpay. We have the best prices, period. The nation's only coast-to-coast, peace of mind service network with over 170 locations. Every mile you travel brings you a mile closer to a partner in our dealer network. The difference is clear. Click, call, or visit Nelson's RVs today.
It all starts with an invitation to experience Lexus. To know exhilaration is just the beginning. What starts with an invitation becomes an experience. The invitation is always open, but the offers only last through March 31st.
Get 0% APR financing on the 2021 IS300.
Experience amazing at your Lexus dealer.
Buttercup. Baby, just to let me down.
Let me down. And mess me around.
And then worst of all,
If you ride, you get it. Geico Motorcycle. 15 minutes could save you 15% or more.
Man, this looks so good.
Oh my
There's
God.
Oreo inside of the cookie dough.
No, there isn't.
Yes, there is.
No,
Dude.
there is. Oreo, Big Scoop, Cookie Dough Blast, and Sundae.
Brilliant.
If you're looking for the latest numbers and trends related to the pandemic or a place to pre-register for a vaccination, you can go to coronavirus.idaho.gov. CrushTheCurveIdaho.com also has a tool to help you find a vaccine location and appointment. They say their team stands ready to get you placed, and they have helpers to help you out. Central District Health has information and resources, including a vaccine pre-registration system on its website as well. That's cdhd.idaho.gov. And of course, for the latest news and information, an interactive map and timelines tracking COVID-19 numbers and trends in Idaho, as well as other resources, you can go to our website, ktvb.com. That is all of our time for this week's Viewpoint. Thank you so much for watching. I'm Doug Petcash. I'll see you tomorrow on Wake Up Idaho and right back here next Sunday morning for another Viewpoint.